that is the topic that we want to dissect with you today. Why did we choose this topic? As you are well aware, this month is October, and October, it is known to be the month for breast cancer awareness. And this awareness starts from the 1st of October to 31st day of October. Okay, now, what is breast cancer awareness month? It is a month that usually it started from America. It started from many cancer charities in America, and they called October. They made October to be the annual international health campaign organized by major breast charities, so that every October there's an increased awareness to breast cancer disease. And it is also used as a time to raise funds to help women who have this disease. So it is very important. That is why breast cancer awareness is a whole month. The month of October is dedicated to it, to make people aware of this deadly disease. So now, why is it important for people to be aware of breast cancer? If someone has breast cancer, why not just leave it, let it develop, and the person goes to the doctor? No, 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 no. Why is it bad for that to happen? Now, let me tell you something. Breast cancer is incredibly very important to be detected early. Why? Because you can catch the disease early. If you can catch it very early, that's when the disease is very, very treatable. But if you allow it to fester and then the whole body is riddled with cancer cells, the problem with it is that these cancer cells, they just don't stay on the chest or the breast where the cancer is located. It starts spreading. This is the chest area. It starts going to those bones here. It starts going to the liver. It starts going to all these organs that you see here. And by the time you know, it's the whole body is riddled with cancer cells. And at that point, it is now stage 4, stage 5. And when you now catch the person, or the person presents to the hospital at this time, what now happens is that the person, there's not much you can do for the person. So what you now do for the person is either you just palliative management, just be giving the person painkillers and everything until the cancer has its way with the person. So that is why we have seen people who have gone through the stages of this suffering, and we say, why let them happen? So now there is an increased awareness for breast cancer in women, both young and old, to let them know that this breast cancer, the best way to curb it is to catch it early, catch it young. When you catch it young, that way it is treatable. You can actually go through the treatment without having long life side effects. But not caught very early, that's when it's a problem. Now, who are those people who needs to be aware? Because as we say, October is the month of breast cancer awareness. Now, which people needs to be aware of this disease? Fine. Let's take gender as number one. If you happen to be a female, a male, you should be able to be aware that such a thing as breast cancer exists. Yes, it does. Now, gender, somebody's gender, it is the strongest risk factor for breast cancer. Gender is. And men can also develop it. But it is 100 times, did you hear me? 100 times more common in women than men. And mostly because women's breast tissue, they are more susceptible to hormones like estrogen. That's why it comes on women more. So now, breast cancer, let's just say we are focusing more on the women because breast cancer has 100 times chances of developing in a woman than in a male. So if you're a female and you're listening to this, please, you need to be aware. You need to pick up interest in this topic because it's actually for you. As you all know, your $1 billion body is a program that is programmed to bring awareness to you about certain diseases that creep in on us. So now when you are aware that a certain disease occurs in this way, and this is the risk factors, and then you become more alert. At any slight symptom, you just go to your doctor and start action immediately before the disease overwhelms your system. So I'm talking about the risk factors, those who need to be aware of breast cancer. Number one, like I said before, is gender. The feminine gender should listen well. This is more 100 times a feminine disease than it is a male. I'm not saying it can't occur to a male. Yes, it can. But if you're feminine person, please, this program is for you. And then if you're a male and you know that breast cancer runs in your family, it is also imperative that you are aware of what it entails, so that you can be able to help a friend, a family member, a spouse, or anybody. Good. Another risk factor in this one is age. Age is another one of the strongest risk factors in breast cancer development. Usually, women who are above 50 years of age are usually diagnosed with breast cancer. But we have 5% of women who are below 40 now being diagnosed of cancer. Now, you might think, oh, 5% is small. No, it's not. Just take Nigeria. We have like 200 million people. 5% of 200 million is a whopping amount of people. So we need to be aware. In as much as it happens to women who are older, it also can occur, but rarely in women who are younger. So women who have passed the age of 50 should be aware, and it is advised that they should get screened at least once a year in order not to be caught unawares. Yes. Another one is family history. Family history, if you have a family history of breast cancer, it is very imperative that you are hypersensitive. You have a high index of suspicion of any breast lump that you might have, of anything that occurs in your breast. Any change, you should be alert, so that you fly into action in order not to allow it to happen. Now, let me tell you, women who have 2 or even more first-degree relatives who have suffered from cancer, like your mother, your daughter, or your sister, if you have any of them who have suffered from breast cancer in the past, you have more than 4 times the chances of developing breast cancer yourself. So it is advised here that you routinely do breast examination on yourself. Once you find anything abnormal, please go to your doctor. Now, one of the main reasons for the elevated risk factor in people whose family relatives have breast cancer is that we have 2. There's always inherited mutation of 2 genes that cause this breast cancer in those women. We call it BRCA1 and 2. Most of these genes are really like mutated in people whose family relatives have cancer, and if it's affected, you might likely come down with it. Yes. So what we are advising is that benign breast conditions that don't cause like overgrowth do not appear to increase risk. Do you understand? So if you have something like fibrocystic disease, mastitis, fat necrosis. Fat necrosis is maybe when you're a lady and you're playing something like basketball and the ball hits you on the chest. In the process of healing, there's necrosis. This fat comes and lumps together, forming a lump. That shouldn't get you worried. But if you have a family history of breast cancer, I think you should take it further than that. Another one is if you've had previous breast cancer before in one breast, it's highly likely that you might develop it in the other remaining breast. So you need to be highly sensitive to anything that occurs in these other breasts. You should be on the lookout. Is there changes in the nipple? Is there development of lumps around it? Is the skin above the breast? Is there any discoloration? You should be aware, because if you've had breast cancer before and you've beaten it in one breast and you're thinking, oh, let me go and relax. No, don't do that. You need to be sensitized. You need to be aware that it can reoccur again and then do something about it. Fine. So another one is what we call breast density. Now, women who have more breast density have less fat in their breast. And the more dense your breast is, the more you are likely to develop breast cancer. How do you know whether your breast is more dense or less dense? We can find this out by going for a mammogram, breast mammogram. It can tell you whether your breast tissue is more dense or it has fat tissues. So if you have more dense breast tissues, that means that you are more likely going to develop breast cancer than the woman whose breasts are more of fat than tissues. Yes. Another one is there are some women that have certain benign breast conditions. Let's just say that women who have had biopsies, yeah, biopsies are when you have maybe a growth in your breast and you want to find out, is this a cancerous growth or not? Then you go to the hospital and the doctor takes a biopsy needle and then digs into that mass and then collects some tissues and then send it to the lab for further investigation, for histology report. When you've done that, when you've undergone such procedures before, now the place that you've taken that cell from, you biopsied from. In other words, collecting cells from a mass or body part is called biopsy. So there's an overgrowth of cells around that place that you biopsied from. And when you do that, that predisposes the person or exposes the person to the risk of developing breast cancer. Even when you have biopsied the tissue and they say there's no histology reports and says there's no breast cancer, you can develop breast cancer just by undergoing a biopsy. So you need to know. If you don't know, you just go home and you see stuff and you say, oh, I just checked nothing. No, you need to be aware and you need to cover it. So this is what this month is all about, the month of October, creating awareness about breast cancer. Why? Because we don't want people being diagnosed at this age and time of stage 4, stage 5 breast cancer. At that point that medicine can offer little help. No, we don't want that. So even if the person is diagnosed with breast cancer, it is caught early. Stage 1, it can be dealt with and the person is cancer free and going about his or her normal life. Another one is women with who have been diagnosed with cancer. We call them Loba carcinoma in situ. Loba carcinoma in situ is that the breast is the lump is just in the breast and it's there in situ, sitting there. It's not going, it's not spreading. Yeah, women with this kind of lobar carcinoma in situ are at increased risk of developing breast cancer in either of the breasts. Yeah, because it is just there, it's not spreading. Once it spreads, it is cancer. So now, if you have such a thing, you should be going for checks so that we know and then curb it or attack it before it causes some very bad damage to the system. Another set of women who should know or who should be aware, in fact, every woman should be, but those who are at risk, at the higher risk of developing breast cancer, are those who are also exposed to radiation. What do I mean by that? Women who have had high dose radiation to the chest, high dose radiation around this chest area as a result of treatment for another form of cancer. Maybe you have Hodgkin's lymphoma, and that's what you're treating. That's it. Hodgkin's lymphoma are those kind of cancers that occurs maybe in the lymph nodes. Lymph nodes are drainage systems or drainage points of the lymphatic system that drains it right in the heart. So there's always a node that the lymph vessels drain their fluid into, and then those lymph nodes can develop cancer. That is not even breast cancer. And then you now use high dose radiation on the chest area, trying to cure the Hodgkin's lymphoma. One of the side effects is that over time, the person can develop breast cancer because of the exposure to high radiation. Yes. No. Now, especially if they underwent the radiation during adolescence. Yes. The time you undergo the radiation treatment matters too. If you are adolescent and that you are diagnosed with Hodgkin's lymphoma and you go for radiation to treat it, invariably before you get to maybe 40, 45, the person has a higher chance, not all the time though, but has a higher chance of developing breast cancer. So now radiation after age 40 does not appear to increase breast cancer risk. Yes, If someone is diagnosed of, let's say, any other kind of disease, and you are exposed to radiation after the age of 40, it might not predispose you to breast cancer, but during adolescence, it sure will dispose you to that. So if you've had treatment or know someone who has undergone chest radiation, high dose for treatment of other kind of cancer that's not breast cancer, watch that person closely. The person should be undergoing breast screenings often, because breast cancer is one of the side effects of such treatments. Yes. Then another risk factor that we look at also is race, the woman's race. Usually, the race mostly affected is the white race. White women, Caucasian women are slightly more likely to develop breast cancer than African women or African Americans or African Hispanics or whatever. But we know that white women, white Caucasian women have more chances of developing breast cancer than Africans. So that is it. Now, another one is estrogen exposure. What is estrogen, by the way? Estrogen is the predominant female hormone. Estrogen is the hormone that turns a girl into a woman, that turns a teenager, an adolescent into a woman, you know. Estrogen is the one that makes you a female, is the one that gives me my feminine appearance. Without estrogen, I might probably have mustache, have voice that are deep and husky like a man, and then I will develop hair patterns like a man. But if you have estrogen, estrogen is a hormone that makes you develop your breast, pubic hair, widening of your hips, basically makes you a woman. That's what the hormone estrogen does to the body. Now, when you are overexposed to this hormone, it also causes a problem. Also can make you have breast cancer. Now, let's see how it does that. Now, the longer a woman is exposed to estrogen, the greater her risk for breast cancer. Yes. So now, what we mean by that is some females now start their menstruation